We often dismiss extreme anger as a bad temper, but for millions, it's something more. In fact, there's a recognized disorder that makes someone nearly 4 times more likely to get divorced. It's called Intermittent Explosive Disorder, or IED, and it's a treatable mental health condition. And it affects up to 7.3% of the population, making it more common than many realize. We'll break down the signs of IED, uncover its roots, and show the path to regaining control. So, what separates IED from typical anger? It comes down to proportionality, impulsivity, and distress. First, the outbursts are grossly out of proportion to the trigger, like screaming over a minor mistake. Second, the outbursts are impulsive, not premeditated. They happen suddenly, with little to no warning. The rage explodes quickly and typically lasts less than 30 minutes. It's a flash flood of aggression. Finally, these episodes cause serious problems at work, at home, and legally. This is actively destructive. While it can affect anyone, IED is more commonly diagnosed in men and younger adults under 40. But what is happening under the surface? IED has deep roots in our biology, genetics, and environment. Let's begin with the brain. MRI studies point to the amygdala, your emotional processing center. With IED, it can become overreactive, sounding a false alarm. This means the fight or flight response is triggered by minor issues. The brain's brakes can't keep up with the amygdala's gas pedal. And this isn't just random. Genetics play a huge role. Studies show up to 72% of the tendency for impulsive aggression is inherited. Genetics load the gun, but environment can pull the trigger. Experiencing abuse in childhood is a significant risk factor for developing IED. So what does this feel like from the inside? Before an episode, many report rising tension, racing thoughts, and even tremors or chest tightness. After the explosive release comes relief, quickly followed by intense regret and shame. So, if they feel bad, why can't they just stop it? The core of the disorder is feeling out of control. Many describe it as watching themselves act from a distance, completely unable to intervene. Imagine being cut off in traffic. For most, it's a moment of annoyance. For someone with IED, it can ignite a full-blown explosive rage. This cycle of explosion and regret wreaks havoc on a person's life, leading to job loss, strained family ties, and chronic stress. Understanding this internal battle is key, but the picture is often more complex. IED rarely travels alone. Remember the question about control? Conditions like depression, anxiety, and substance use often co-occur, lowering the threshold for outbursts. It becomes a negative loop. Depression makes an outburst more likely, and the shame from that outburst then worsens the depression. This is why a proper diagnosis is critical. A professional needs to untangle what is IED and what might be another condition fueling the fire. We mentioned it is more common in younger men. This may be due to a mix of biology and societal pressures around male expression of anger. So let's connect the pieces. How does a genetic trait shaped by childhood result in a broken relationship decades later? We saw that genetics can predispose someone to an overreactive amygdala, the brain's alarm system. This sets the stage for a hair-trigger temper. Then add childhood trauma. This teaches the developing brain that the world is a constant threat, hardwiring that overreactive alarm system. This biological reality crashes into adult life, causing the outbursts that push loved ones away, leading back to that shocking divorce statistic. But that chain reaction can be broken. IED is highly treatable, and recovery is not just possible, it's expected with the right support. The foundation of treatment is psychotherapy, particularly cognitive behavioral therapy, which helps you identify triggers and develop new coping skills. Medication can also provide significant help. SSRIs or mood stabilizers can rebalance brain chemistry, calming that overreactive amygdala. The most effective approach combines therapy and medication, tackling the problem from both the top down with new skills and the bottom up with brain chemistry. If this feels familiar, know this is not a character flaw, it's a condition. Reaching out to a mental health professional is the first step toward rebuilding your life.